So you are about 3 months, right, since surgery
Correct.
approximately?
Mm-hmm.
And we did a lower face neck lift surgery.
Correct.
And we did it under local anesthesia for you.
Yes. Uh-huh.
And why did you choose to do it under local anesthesia?
Well, I had some medical issues with being under anesthesia for a long period of time, but it turned out I didn't feel anything. It was a great experience. It didn't hurt. I wasn't aware of anything. So it worked for me.
What was the main reason you thought you needed that surgery?
My neck had drooped and it was just too much. It was a turkey neck. And I had thought about doing it many years ago, and I just kept pushing it off and pushing it off until it finally came to the point where I was doing what most women do. Put your hands and see what it looks like if you pull it all the way up. So, and I thought it would give me a more youthful appearance, and I definitely got a more youthful appearance. And my chest is pretty good, so it's a really nice look that I have. And I've got my jawline back too.
I may get in trouble, but a lot of patients want to know, how old are you?
70 plus. I'll be 71 this July.
You look great, absolutely great. You have great skin, and now a jawline and a neck that matches. So tell me how your post-operative experience was.
Well, it was more complicated than I thought it was going to be. I had these wounds that I didn't expect, but Dr. Kusuma was there 100% of the way. It's just, I needed just patience and support, and that's what he gave me, patience and support. It was ugly. It was painful at times, but I felt that I had really good care and that eventually it would subside, and it did subside.
And so now at about 3 months out, are you feeling 100% back to normal? Do you feel any sequela of any restrictions of any type?
No, I feel pretty much normal. The first couple of months, the first month, I was very tired, and I was also going through different treatments, but over time there was more and more strength came back. So now I'm really at full capacity.
So, you had, like you described, a little bit more of a complicated course, and you navigated that successfully, and now you're on the other side of it. Having gone through this, I mean, this is not very common, in this type of surgery, but it happens occasionally, and it happened to you. But we managed it well, like you described. So, having gone through it, would you do something like this again? How did it make you feel overall about the actual decision that you made and the outcome that you have, and in context with the complication that you experienced?
I never doubted myself going through the procedure. I was just upset that the complications had to happen to me. So friends have asked, would you do it again? And I would say, yes, I would do it again, but just hope that I didn't have to deal with the extra complications. But there were things that were normal that were going on, and there were things that I had to personally deal with going on. And it seemed like we caught it early. So by the time it came to where I should be, I think I'm almost where I should be. And I look at myself now and I feel great. I feel really great.
What kind of feedback are you getting from family and friends that see you now that may haven't seen you in a while?
Well, one of my neighbors, friend of mine, who never says anything, said I look gorgeous. So that was good. My brother and my sister-in-law and another sister-in-law didn't even notice that anything, was done, because they said I look just like me. It was so natural looking. And I get a lot of nice comments from my female friends who really aren't into plastic surgery.
And one last thing. So if you were to talk to a friend or a family member, what would you advise them? What would you recommend to them if they're thinking about something like this?
Well, they have to know that things could possibly go awry, but to have patience. Have a lot of patience. You're not going, it is surgery, and when you read the information and it says, well, you can be out in public in 2 weeks and you can do this in 3 weeks, it's not always the same timeline. So you just have to have patience, be aware that the body is going to heal. And the one thing that I learned is that the body is a miraculous organism. It kind of takes care of itself over time. You just have to have a lot of patience, and you have to have a lot of confidence in your doctor too, that your doctor is going to take you along that path. But it is surgery, and surgery has complications sometimes. But in the end, I'm going to be just great.
Great. Thank you so much for sharing.